right. I am super pleased to now invite to the podium an esteemed group of state-level visionaries who are each and collectively supporting our local efforts to design one integrated system of care. Happy to have joining us in a conversation around shared leadership, Christine Bagley, manager from the Safety Net Office of Statewide Clinical Services at the California Department of Developmental Services. If y'all want to come up, panelists, we'd appreciate that. Boylan is a deputy director at the Office of Strategic Partnerships at the California Department of Healthcare Services. Brenda Grealish, newly appointed executive director of the relatively new, right, at the California Commission for Behavioral Health. Thanks, Michael. Grab your name tags, your name tents. Katherine Lucero is the director of the California Office of Youth and Community Restoration. Sara Rogers is the System of Care branch chief at the California Department of Social Services. I think we have enough seats. Someone might have to join me at the podium. Sohil is the director of the Children and Youth Behavioral Health Initiative. You know it as CYBHI. And Michael Wimberly is an an education programs consultant at the California Department of Education. And we do have seats for all. Fantastic. All right. Moment of appreciation in advance for our panelists. All right. Shared leadership is a long-standing pursuit of integrated care, whole person, whole child, whole student care. And this is an esteemed group of visionary folks who are challenging notions in Sacramento about how we have done that in the past and what we're doing going forward. So really thrilled to have this conversation with you this morning. We're going to start with a question, and we'll open this to anyone on the panel, of course. But let's start by reflecting, if we can, briefly on how you or your state-level partners are seeking alignment of a shared vision for whole child, no wrong door services among partners serving children and youth. Again, reflecting briefly on what you or your state-level partners are seeking, how you're seeking alignment of a vision for whole child, no wrong door services among partners serving children and youth. Happy to start with either maybe Sohil or Brenda here.
All right, can you hear me? Good morning, happy Monday. I'll just hold it here. So the question is, how do we align on this vision of oneness, as I understand it? And I think in part that is the goal of the initiative that I have the honor of directing, the Children and Youth Behavioral Health Initiative. The goal there is to center the youth, right? To center our communities, our children, our youth, and our families, and to wrap them with love and support and services wherever their lives play out in many different shapes and forms. And for that to happen, as I've really learned from you, Richard, in many respects, and everyone around this table, it's about the structures, the functions, and the outcomes to make that happen. So it's about building new designs and new types of initiatives. In a moment, I'll pass to my colleague here, Autumn, to talk about how some of those structures really relate to the way we structure services at schools and center the delivery of healthcare in that space. Another effort that's redesigning the system entirely is really treating both the child and the caregiver at the doctor's office at the same time. Working closely with Director Lucero here to recognize that youth who've been in the justice system are all of our kids, right? And how do we ensure that they get the services they need wherever they are in the right shape and form? So to me, Richard, I think it's less so about why this is important, but more so how. And I think we're starting to see some of those ways take shape through this initiative and then being promulgated by many of the other acronyms you mentioned at the top, Knecht and the Behavioral Health Services Act, really spurred on by the impetus that Sara is charging us with.
Thank you. Autumn, Brenda, any thoughts as a follow-up to Sohil?
Sure. Good morning, everybody. Autumn Boylan with the Department of Healthcare Services. Glad to be here with you this early Monday morning. Just to add on to what Dr. Sood said just a moment ago, the Children and Youth Behavioral Health Initiative is part of an overall master plan for kids' mental health. And one of the things that I think is so important to note about the master plan is that it's not just about health or behavioral health. It's also about education and community schools and the California Advancing and Innovating Medi-Cal or CalAIM initiatives, which really are focused on bringing together a whole person care approach to the treatment and support of individuals in our Medi-Cal delivery system, in our schools, in our juvenile justice population, and really starting to build a system of care that recognizes that the children and families that we serve don't have these compartmentalized needs. They don't just have health needs or just have educational achievement or just have juvenile justice or foster care involvement. All of these things are happening for our youth and families at the same time, and our systems need to be able to provide the support that is needed to address those whole child needs. And so I'm fortunate in my role, which is to lead the Office of Strategic Partnerships, to really think about what that strategic partnership framework needs to look like. It's like Dr. Sood said, it's about health and education coming together. It's also about health and behavioral health and juvenile justice and foster care. Proposition 1 in the Behavioral Health Services Act, as well as our BH Connect waiver, are all expanding upon that whole person care approach. And I think it's a really fortunate time to be working for the state of California and to have amazing leadership in the state. It's really driving that whole person care strategy.
And Brenda Grealish, Executive Director for the Commission for Behavioral Health, and just echoing the sentiments of my colleagues. I've been in this field for a little over 25 years, starting with the initial children and youth performance outcome system that was implemented back in the late 90s. And, we've been trying for decades now to really think about how we can best serve our children and youth and their families and caregivers in our state. And just even reflecting on the last 20, 25 years, it's amazing how much progress has been made over time. It's almost like a pinch me moment, especially with all of the investments that have been made in behavioral health in general, but in particular with a significant emphasis on our children and youth, really understanding, how much of a impact these services have on their lives and the future for our state and our country. At the commission, I think we have a unique role because we not only can partner and collaborate with our system partners at the state level, also at the local level, but we also have an independent nature that really gives us a unique opportunity to really look objectively at what's happening in our system and try to make recommendations and for investments that can be made to really improve services for our children and youth and their families. Like Autumn was saying, it's this multi-system involvement. We've listened just even recently. We have our advocacy grants. We have 2 advocacy grants that we focus for the children and youth population. One is for our K through 12, and one is through our transition-aged youth. And so, even just recently, hearing from our transition-aged youth, one of the things, and we were having listening sessions as we've been working to develop our newest and upcoming TAE advocacy grants, is just how challenging it is for them to access and navigate these systems, especially as they're coming of age, coming from being children and youth in the system to becoming young adults, and just how that transition is so challenging, even for youth who are set up in as best a situation as possible. It's still challenging, but you can imagine if you're a system-involved youth involved in one or more systems, how challenging that can be. So really, I think there's been a lot of work at the state level, just working across. I've worked with many of these folks for years and just admire them so much in terms of, all the hard work and dedication that everybody's been absolutely pouring into our children and youth population. And there's so much work to be done, but so many opportunities with everything that Autumn just mentioned, with the Department of Healthcare Services, our social services, this emphasis on our children and youth in the justice system. So I'll push it over to, I think, Director Lucero to take it, because that's actually one of my passion populations. So there's just, I think, an emphasis that we have never seen before that's really a great opportunity to move us forward.
Thank you, Brenda, and to my colleagues here on the panel. I loved hearing this morning that what we are after is wider and deeper relationships with an abundance mentality in a time when scarcity and fear are imposed upon us like some sort of tablecloth. But we don't have to accept it, because we know the richness that is the state of California, the vision of our leadership, of course, starting at the very top, and then the Secretary of Health and Human Services, Secretary Kim Johnson, is that we work together to make sure that promise that every youth in California is served. Every youth. Not just youth in certain categories, but every youth. And our office is proof that we mean business. The ultimate barrier breaking was shutting down DJJ. And exactly, yeah. And in the 90s, we had 10,000 kids in 13 state prisons, state of California prisons. And today, I just looked at the number, we have 631 kids in 37 secure youth treatment facilities in the counties. That is amazing. And now what we really need to do is bring those kids, and total population of incarceration of children is about 2,800 in the state. That's a number we can get our arms around, and we want to bring the kids in to make sure that they're part of every single initiative in the state of California, whether it's a literacy initiative, an app, a mental health app initiative. We want to make sure those youth justice kids are part of those initiatives. And I work closely, and my team works closely with all the folks up here, and I just want to thank them for our tireless calls. I've been accused of elbowing my way to the table, and what I need to tell you is that this is a worthy endeavor to make sure that every youth, even if they made a bad mistake, is included on this agenda. We work closely with Dr. Sood, with Autumn at CYBHI, with the Department of Rehabilitation, Workforce Development Board, the Department of Education, the State Board of Education, DOJ, the BSCC, and the Attorney General. And you know what? Relationships are key. Relationships are key, even in this time of AI, even in this time of super tech, tech. It's still about relationships. And I just want to implore us to remember that. And another important point for this, the youth justice kids that are embraced wholly by all of the CHHS partners, is that we need to focus on educational health for our youth in the justice system, because that is social health. That is their job. So we have to make sure that they don't get suspended or expelled, or that they are not being forced to take a bus for 2 hours to a school outside of their district because they're not welcome back. And I think we can do that. I think we can get the supports we need, and I think we can do that together. And there's a lot of intentionality here. A lot of intentionality, just like we expect of our counties with the AB 2083 intentionality. We have that, and I'm very proud to be part of that team. And here's a really important person next to me.
You're very kind. I think the way that we have been looking at that, the three of us at the end of the table are part of a kind of corollary initiative called Children and Youth System of Care that's really looking closely, I feel, with you all in this room, not at the system level as much, but really actually trying to look at it from as Christine often says, who are the people holding the hands of our children? And what can we do as a state to be more accountable to the needs of the child, but also to the people who are actually really holding their hands day in and day out, truly seeing the needs? And so, from that vantage point, what are we doing? How are we seeing the needs differently? We have a technical assistance model, child specific, where we try. I don't know that we always succeed. We try to stand next with you, right beside you, and ask, how can our systems together actually impact a child for the better? When I heard Susan in our prior presentation ask, how many of you have been system impacted? And I was like, oh, that's a bad thing. You know, when you ask that question and you raise your hand, that's like, you kind of have an idea like it's a bad thing. What would it look like for that to actually be a good thing? And that is really the question that we're trying to ask. And so my answer to this question is that the state really needs to turn the accountability around and make it something where we're starting from the question of what's best for children, and we are being accountable to you. And sometimes it's it's a bidirectional accountability, but that's, I think, what's missing, is a way for us to be more accountable to your real life experiences, not from one system. Because I think that sometimes we listen to our system partners, our department listens to county child welfare, but we don't have a way to listen as a system of care. And personally, my own passionate answer to how we would do that differently is really looking at the 24/7 reality of real life. A child is in a 24/7 reality. They go to school, they are at home, and they have community. And we need to start the question of, how do we see this child in the context of their community? What are their needs? What's going on? Understand child development science and trauma science, and then move from there. And then the last thing I do really want to say for our system is that most of our children in child welfare are profoundly disconnected from family, from community, from love and belonging. And there is nothing any of us can do to support that child if we're not all committed to seeing that as the fundamental core need of every single child. And then, as a system of care, really asking, how do we all play a role in reconnecting a child in that proper social context? And there's mechanisms to do that. We need to be asking, how do I as a human see the needs of my child, and how do I respond? And so that becomes a bureaucratic question, but how do we make it accountable to the human? That is what I think 2083 and system of care is really about. And that's why I love this interdepartmental kind of inner community space. So thank you.
Yeah, anything from Christine or Michael on this question? We got lots of time for you all later, but happy to.
I love what's been shared today, especially the mention of community schools, the whole child, the 24-hour day. You know, I often say almost on every TA call or whenever anybody listens to me that a youth spends half their waking hours in school. It's where they have a community. It's their ecosystem. At first, they learn how to be kids. Then they get responsibility in school. They gain relationships. You know, they work together. They have accountability. They have homework, things like that. They learn skills that lead them into adult life. And to be able to support that. And one of the things that we're doing, and I'm very proud of the state for doing this in the Department of Education, is community schools. You know, that addresses a whole child. They're trying to address and get all services into the school. Easy access for families and the youth. Wouldn't that be great? Your youth goes to school during the day, family, child can get services they need. And then integrate those outside the school. And I know that the people that are on TA calls and hear me speak all the time, it's all about that integration of services across the board, in and out of school. Because it is about the whole child. Everything should be about the whole child. You know, California has invested billions of dollars in community schools over the past years, and you know it's huge. The grant is huge. The cohort that are working with this is huge. And the end results and outcomes have great expectations. And so I'm excited that we're on this path and everything's about integration, or should be.
Thanks, Michael. All right. Thank you for that. Let's move forward a little bit and invite ourselves to ponder on a second question, if you will. Other than financial resources and revenues, I'm going to put that aside because it's easy to get distracted by that challenge. Could you share a bit about what you or your agency, how you or your agency see the barriers toward an authentic and functional ecosystem in California? What's the current or next obstacle that you're challenged by? Christine?
Hello. Oh, wonderful. Good morning. Well, I would just I think when I thought about this question, the one thing I would celebrate is I think that our state departments have made like incredible strides in our approach to engaging communities, community feedback, input, focus groups, roundtables. You just see like such a deeper commitment, I would say over the last 10 years of really intentionally trying to center our decision making around the voices of communities. I think we've made incredible strides. But the one thing I think that I'm really have been reflective of is that often that feedback and the input we're receiving for our decision making processes still is kind of bidirectional, right? Coming from the Department of Developmental Services, I'm hearing from my community about the challenges and barriers that they're experiencing with our system. And I would say it's probably the same, right? The school and education system is hearing from their community about barriers and challenges in accessing school systems. And so I think the opportunity to kind of move deeper in our removing barriers and understanding a collective ecosystem and integration is what would a world look like where our feedback and community engagement was really reflective of a whole system and whole child, so and family, quite frankly. So I see that as kind of not necessarily a barrier, but an opportunity for us to really go deeper in understanding like the collective challenges that a family may be facing.
Thanks. As others ponder on this, want to invite ourselves to be as specific as we can relative to what are the functional barriers? Like what are you up against that you're going to focus on as a department or an agency going forward towards oneness?
How many people in this room love acronyms? Yay. Yay, acronyms. I think that's one of the functional barriers that I encounter. We at this table are in charge of AB 2083 SOC, CYBHI, BHSA, BH Connect, right? The list goes on and on and on and on. And I think sometimes we're all trying to get our work right. And that's so important to be really a specialist in your effort. But it also takes effort to break those barriers and to cross those aisles and to move into understanding these other spaces better so that we can align, so that we can integrate and work toward that. I think it starts, just as Director Lucero was saying, is working on the relationships first and then building those structures to learn in a way that moves toward action. So we connect regularly. I connect regularly with the Department of Education to understand what is community schools, right? Well, what does that multi-billion-dollar effort look like? And through that, I'm learning about planning, implementation, coordination grants, and that's helping me open my eyes into how can CYBHI fit into that, and vice versa. So it's about really understanding the nuances about these other pieces of the work so that we can overcome it and align and integrate.
Thank you. Other thoughts, please?
So I really align with what you said, and I would take it one more specific maybe step to say from our point of view, and it really still comes down to the people who are holding the hands of our children, and how can they bring together and align the real responses that government entities actually are supposed to provide. So when you're in education spaces, the things that a child needs are not easily connected to the things that a behavioral health system might be providing, or a regional center, and certainly not often child welfare, and so on and so forth. And so I personally think the barrier is ways for the people on the ground to experience the systems as something that is responsible and accountable to their role of being the one who's closest to the child. And so to take it even more specific, it's our funding structures, it's our documentation processes, it's the guidances that we issue that are all siloed. It is extremely difficult for the multiple departments to from a state point of view, develop guidance that makes any sense in real life across 4 systems. Like, it's stupidly complex for a state person to do that. It's just not possible, honestly, in my opinion. So that's the barrier. So the barrier then, how to overcome that barrier, is somehow reversing the information stream and having the people who are closest to the child be trusted to see the needs. But it cannot be one system. So if you're here from one system, you're like, yeah, I see the needs. You should listen to me. I don't think that's it either. I think that we all really need to come together and assume that when one of our systems is not able to be understood by another, probably we're all missing something. And we need a way for the person on the ground closest to the child to see the need of the child and family, and for everybody else to align to that. And then for us at the state level, then our job becomes, how do we shift the rules? How do we shift the bureaucracy to make that possible? At the same time, there's reality of like federal rules, and there's other dynamics that we all have to be mutually accountable to. But I personally think that what's missing is the closest to the child up, and that really is the family, and maybe the teacher. It's the teacher and the family who are the closest. And what does it look like for all of us to start to align to what that person is seeing as the need?
Yeah, can we build on that, Sara? Thank you. In my opening reflections, I tried to celebrate, particularly Department of Social Services and Healthcare Services, that on 3 or 4 occasions in the last 2 or 3 years have actually gone to this heaviness of crafting joint guidance. Those letters, those all-county letters, all-county information notices, when they come out with letterhead from multiple agencies, have much broader impact just by virtue of the fact that they're read by partners locally across the system. And then that forces a conversation into local scenarios around, did you get that letter over there? Did you guys see that letter? Right? So this is the huge step forward, and just in terms of the guidance alone. So thank you again for leading that, and for others who've been involved in that. Super important stuff. Other reflections around this question, Katherine?
Yeah, thank you. So I think if we are focused on designing systems, then we're telling people that we value systems. But if we're focused on serving people, then we're telling our systems that we value people. So I really loved Sara's focus on the family and the child, the most local that we can get. I think there's 3 specific barriers. The first that I see in my realm is narrative shifting. I think that historically, youth and the youth justice system have been easily thrown away by our systems and kind of relegated to a part of our system that we felt, that we were all safer if kids were locked up for a really long time. But we know from research that doesn't make our community safer. So I think there's a lot of narrative shifting. And I think that we have to be honest with each other about the fact that a lot of this is racial bias. And I think no matter how good our systems get, we're always going to have an overrepresentation. I'm very, a lot, like 90% of the kids that are incarcerated are kids of color. So I think we have to be honest about narrative shifting. I also think that we have to look at the tension between our state and county government. And, a state's good idea is often a county's burden. And I think we have to be honest about that. And I think that leads to the third barrier, which is making our initiatives accessible and becoming fluent in what's available so we can help our counties become fluent. And I'm often joke that I feel like the Medi-Cal, and CalAIM and all of that is like an Egyptian pyramid that I have to crack the code. And so if I feel that way, I'm very well educated and I went to law school, gosh, how is everybody else feeling about it? So those are three very specific barriers that I see.
Thank you.
I would just add, I think these are all great comments. I would add time, because as I'm listening to my colleagues on the panel talk about the barriers and really focusing on serving people, real systems change to do that takes time, and managing the expectations of our policymakers, of our educators, of our healthcare providers, and all of our various systems. People want to see success immediately, right? And we want to make sure that kids are getting access to all of the services and supports that they need. But to do real change, to integrate our systems, to really redesign in a way that is valuing the people that we're serving, it's change management and it takes time. And we, through the pandemic, it became kind of, which I think is great. It's one of the highlights, I think, of COVID-19. Kind of the idea that it's okay to not be okay became much more prevalent. And so we start to, as a society, recognize that as individuals, it's okay to not be okay. But I think sometimes we also have to recognize that as systems, as serving organizations, that through that change process, it's not all going to be perfect, and that it's okay for things to get a little messy and to take risks and to try new things, even if they don't work every single time. Because if we don't intentionally try to learn from our failures, then we're never going to get to a place where our systems are really optimally designed to meet the needs of the children, youth, and families that we're intending to serve. And as somebody who leads a couple of very large change initiatives, I know that that's one of the things that's like, if I could just hit that pause button and let things kind of settle, then manage everybody's expectations to that future state, that would be a lot easier. But instead, you're managing expectations from the beginning, and really it takes that time for us to get it right. And I think we have to recognize that.
Thanks, Autumn. Did you all hear that somebody at the Department of Healthcare Services in position of power said it's okay to hit the pause button and reflect on the needs for implementation, right? So don't you love that? Thank you. Thank you. Yeah, Brenda.
Yeah, thanks so much. Just I love what everybody's saying up here, and just wanted to add, just having worked in these systems for so many years, time and I think grace and respect for the complexity of this work, kind of to what Director Lucero just said. These cross-sector partnerships are super hard, and becoming experts across all these systems so that we can be better for our counties is super hard, or our different providers and our families, super hard. And it's frustrating because we're all trying to learn, we're trying to do our own work, we're trying to learn, we're trying to help all at the same time, and it's just and we're strapped for time, and so it can be so frustrating. And but really having respect for that complexity and grace, and understanding with one another, because these are very complex systems. And I always sit there and say, from my multi-sector work that I've done, which I probably is one of my highlights, I love working across sectors. But it's so hard, and it's like I'll be in meetings, and we're using the word services for 6 months, and then we realize, uh-oh, we've been using the word services differently. Different people in the room are showing up with the same vocabulary, meaning different things. And here we've been working on something for so long, thinking we're doing one thing, and actually we've been working on two different things. And that happened. That's the messy part of all of this. But we need to get messy. We need to be able to roll up those sleeves, get to those 6, because at least we found out, and then that's learning, and that's what we need to do. We need to take the time to do that, to learn it, apply it, and this is how our systems evolve. So I just want to actually just add that on, because it's an important part of the process, and it's something that I don't think anybody, or we just don't take a lot of time to really pause and think about it.
Thanks, Brenda, for naming that time issue and reminding us, I think, on some level that while collaborative work takes some extra time to develop and design, once it's present, it's actually quicker to solve problems, right? Think about the last time you tried to chase a partner in a different department or agency, and you didn't have a relationship with them and they ignored your emails, right? Or your phone calls. So the relationships are the solution to that time issue. Beautiful. Any other thoughts around these barriers? Right. I won't open the rabbit hole because it's way too deep and way too broad, but information and data is probably the most universal of our obstacles across the systems. And there's plenty of time later in our conversations today and tomorrow to address this. And there's some smart folks who are going to put together some panel presentations for us to talk about linking our data and information as well. So we'll skip that for now because that's a long conversation and difficult conversation. All right, let's move on. While California policymakers have often embraced a shared vision or commitment to whole child, whole person services, could you share some thoughts about how you and state partners are approaching the functional sharing of responsibility across agencies? So Sohil called out the structure in his first reflection. The structure holds the functions in alignment and is a place to capture a vision, but actually weaving together the things we do, that's another lift altogether. You've begun to comment about this a little bit, but maybe just want to create some space for identification of other ways that you're seeking to blend and braid the functioning, not just the money, but the other functions. Thoughts about that?
Happy to jump in, and maybe a specific example will help, and you'll see, I'll tee you up in a second, Autumn. But California is trying to create really codify a new profession in the state, right, called a certified wellness coach. A new type of role to really help youth to serve as part of the pipeline to create more homegrown specialists that look like your community, that come from your community, that speak the language, right? That is happening primarily in a department that's integral to this conversation, but not represented on this table, the Department of Healthcare Access and Information. But the key really to sustaining that is to link that to the healthcare system and to recognize that the way to fund that type of position is not out of existing pots of money that schools and providers are already taxed with in many respects, but to say this is healthcare, and the healthcare financing system should reimburse for the services provided by that person and by those efforts. So the functions that need to happen is that the teams designing this service and the teams working on the reimbursement of this service need to work together and for that to happen. And so we've been working on that for years now, really looking at what that looks like, both at the state level, even at the federal level, to have those conversations, to create this type of new role that hopefully is a game changer and really allows everybody else to work at the top of their game in a team-based model as well. But it takes different functions for that to happen. And Autumn has been an instrumental partner in working with the folks over at HCI to really see that longer-term vision of designing a profession and sustainably funding that profession together.
Yeah, thank you. I think that's a great example, and that's kind of what was coming top of mind for me as well. I think it goes further than just the certified wellness coaches. So in the CYBHI fee schedule program, how many of you have heard about that already? Oh, good. I like to see a lot of hands when we talk about the fee schedule program. Not a very creatively named program, but nevertheless, it's really about kind of that recognition that Dr. Sood was just talking about, that there's a responsibility of the healthcare system to fund and cover services that are provided in schools. And the recognition that schools, as we heard from Michael, is the place where kids spend most of their time. If they're not at home or they're not in community, they're in school. And schools have, by necessity, kind of really become the forefront of healthcare for our children, youth, and families, for behavioral health, for vaccinations, for whole child dental care, vision screening, all of the things that our kids kind of need as they're going through their school-aged years are first assessed and provided at the school site in many cases. And so holding our health plans in the state of California accountable for coverage of those services, particularly in the behavioral health space, is really where the fee schedule program comes into play, because it is a financing strategy to ensure that there is sustainable, permanent funding for the functions that are carried out in schools every day. And really, that's part of that kind of shift in terms of how we're doing business, by making sure that schools don't have to cobble together every little grant of one-time funding, but can supplement the local dollars using dollars from our health plans, which are paid to provide essential health benefits to their enrolled members. And so it's kind of thinking about how these systems all come together. Similarly, I also oversee the reentry initiative under the CalAIM program, which is thinking about the role of healthcare services and Medi-Cal specifically in our correctional institutions, and thinking about how Medi-Cal can support youth who are incarcerated in juvenile justice settings. And then what is the role of education in providing educational services, behavioral health to those same populations, and how do all of these pieces come together? I think these are some of the things that we are, grappling with, but it's so important to think about these cross-functional settings and to support the work that's already being done in schools, in communities every single day.
Thank you. Other thoughts from the panelists around some of the functional connection efforts?
I can just add a little bit more onto that in terms of some of the work that the Commission's been doing for the past 5 years. In terms of, we have Behavioral Health Student Support Services Act grants. So there's been a $280 million investment in trying to strengthen the relationships between counties and their local education agencies and school districts. So we've have, I think, grants in all but one county, one small county. And we've reached approximately 45% of the public school districts through these grants, which are still ongoing. We are currently working on an evaluation. So we have a contract with WestEd that'll be working to do an evaluation of these partnerships. But really, this grew out of a longstanding need to try to get the schools and the county behavioral health departments working closely together. There's been lots of changes over the landscapes, and I know when I was at DHCS, there were bills that were that folks were introducing and trying to work to try to get to force school behavioral health departments to contract with schools. But in Medi-Cal and our programs, their counties have selective provider contracting, so the state can't say who counties will contract with. So this significant investment was a way to really seed funding to try to get these partnerships established, to be able to get that flow going between the county behavioral health departments and their school and their local schools. So it'll be something to look forward to in terms of seeing how that has gone, both in terms of process and outcomes evaluation.
Appreciate that. Other thoughts on this question?
I'll take a minute to. So the functional sharing of responsibility across agencies is happening. We have a lot of cross collaboration meetings. There's a behavioral health task force. There's a lot of knowledge sharing that goes on. So Dr. Sood has an all hands meeting. and we're invited. Different departments are invited. It's really about sharing information, and that's how we share the load. But I do want to mention that the Department of Rehabilitation has been a very good ally to the Office of Youth and Community Restoration. And I think about Damien, who wanted to have his own restaurant. He was in DJJ for 4 years, and then he was in lockup in LA County for a couple years. And he had to get on a lottery to get into culinary school. And I told the Department of Rehabilitation that our kids can't wait for a lottery, because we need to act, right? When they step into the community, we have to help them make their dreams come true. So they funded his culinary institute. It was a private institute that he researched. He showed me all the brochures when I went to visit him at the transitional housing in LA. 2 years later, he's a chef at Nobu in West Hollywood. So I just say that because there is such will, political will, I don't know what you want to call it, to share the responsibility. But again, it goes back to relationships, and it goes back to taking the time to meet. And I know it takes time. Innovation takes time. They say a law takes 8 years to implement. Like, that's a long time. And when I see the kids coming out of custody, I know we don't have that time. So in the meanwhile, we gotta do it's and, right? Yes, and that's why we take vitamins. Just tell you. Just thank you.
Thanks. Amazing example, right? Like, you can imagine in Los Angeles or any other county, right? Like, the probation authority, and in LA's case, the Department of Youth Development, don't have the resources, capacity, or expertise to get him into culinary school. Not our job, right? Not our scope per se, but by reaching beyond to the Department of Rehab, you make the connection, the horizontal integration, and the resources are suddenly present for this young man to have a life dream.
Okay. So the one thing I just wanted to kind of like, after kind of hearing everybody's comments, that I wanted to lift up really is around like the interdependencies of all of our systems. And, I think another kind of, when we think about the kind of structures or the kind of functional things that we're putting in place, right? Like, all of these initiatives are rolling out, all of these investments, and it is so much, right? And so many moving parts. And, I think like Autumn and lifted up around like the time, things are moving rapid fire. And I think, again, I just want to wrap us back to some of the functional structures that AB 2083, the system of care, puts in place at the local level and at the state level, which is, right, these leadership bodies, the decision-making bodies, the sharing of language, and, the kind of like functions. How are we utilizing CANs to understand needs? What's our common shared spaces? Because all of these initiatives and all of these efforts, right, if there isn't the container, right, at both the state level and the local level to understand and kind of weave together, there's all these doors, and we're trying to create no one wrong door, but our systems have to understand all the doors that exist. And so I just really want to kind of cinch it up with the fact that, right, interagency leadership teams, at the local level, our joint resolution team at the state level, CANs, joint child and family team meetings, like those concrete functions, right, that AB 2083 has constructed for us, really, I think, is the opportunity for all these investments to really respond to the family and children's needs.
Thank you. Very good. Appreciate that. Anything else on this question? All righty. I think we got time for just a couple of reflections maybe on our fourth question. Issues like prevention, information management, revenue sharing, and cross-training at the local level could be more easily accomplished if state policy incentivized such efforts. You've begun to hit on this already. We've celebrated some efforts. Are there other key areas being targeted for state attention relative to aligning policy so that local designers and implementers can have a little quicker road to implementation? Any thoughts about that?
Are you looking for like specific examples here?
That'd be great.
Okay, great. So in our space, we are implementing a new tiered rates model. And one of the components of that is really founded on high fidelity wraparound. And it is centering that initiative, that intervention as the how we see the needs. And not just from a child welfare point of view, but actually also from a very integrated, fiscally integrated model with behavioral health. And we actually are going to be doing this hand in hand with Department of Healthcare Services to create an integrated braided funding model of care, it completely in partnership with shared guidance. At the same time, that is the model for how we intend the regional center services, the educational supports. How does that all come together? A child might have an MTSS plan, they may have a 504 plan or an IEP, and they may have a IPP and a child welfare case plan and a mental health treatment plan. And so literally the complexity of that is so mind-boggling if you're an actual human being, not an AI bot. So what we think is that this is a model for how we would incentivize that partnership and really allow people to work together. And then we're issuing shared guidance on CAN's implementation, issuing shared guidance about all aspects of this rollout. It's still just 2 departments, though, however, and we're looking at ways to issue potential guidance across all 4 departments on how you would coordinate an IEP and an IPP and a mental health treatment plan and a case plan. Literally, what would it look like for those things to come together? And in a way that actually is doable for the humans who are there, in the work. But we would not be able to write that guidance without you all really participating and informing it in a way that it makes sense. So that's our answer from our system.
Well, one child, one plan.
That is my dream letter
There you
to
go.
write.
There you go. I'll help you write it. Other thoughts about this question?
I already spoke earlier about the Children and Youth Behavioral Health Initiative fee schedule program, but it really is kind of addressing this specific question about incentivizing prevention, information management, revenue sharing, right? The whole crux of the program is holding our health plans accountable for coverage of services that are provided in schools and funding those services on an ongoing basis. I mean, as we were designing the fee schedule program, really looking at the multi-tiered systems of support and the various kind of activities that are carried out in schools through our pupil personnel services, credentialed providers, thinking about what do we want to make sure is reimbursable through the health plans, including a wide array of prevention activities to help identify, you know, behavioral health needs, screening, assessment, psychoeducation services, and the certified wellness coaches as well are really prevention oriented. So providing incentives in the form of funding in this kind of permanent, structured way is one of the ways that we're incentivizing these partnerships between our health plans and our schools, as well as community-based providers, because we also know that it's important to bring in the communities, which is the whole concept of community schools, and think about the role of our community partners, our schools, our health systems, all coming together to meet the needs of our children in our K through 12 school settings. Also applies in our California community colleges, California State University, and University of California systems. So really through that lifespan of brain development, 0 to 26, how are we thinking about financing of services and supports across the continuum of care with an emphasis really on prevention and early intervention? As part of the CYBHI, we also launched Soluna and Bright Life Kids, our digital behavioral health tools, which provide a specific focus on preventative services so that kids or parents and caregivers, teens, young adults who need additional support or a coach or a peer community can find that community in a digital space and then get connected through those programs back to the community and providers within the community or schools who are providing an array of services. And so really thinking about how all of these pieces fit together and are structured in a way that that all partners are incentivized to work together to really meet the needs that are just unfortunately really in demand for youth mental health services at this point in time. So I think, that's, again, one of the things that we're working towards, but there's all of these tools that have come about as part of this CYBHI that I think are really moving us in that direction.
Yeah, thanks, Autumn. All right. Go ahead, Katherine. Yeah.
Yeah. In the juvenile justice space, we have the CalAIM Justice Package that encourages a 90-day in-reach so that when youth leave custody, they're leaving with supportive services like behavioral health services and a variety of other services, credible messengers, things like that. And it's not just you walk out the door and you're not supported. So that's definitely incentivized. And then capacity building, as Autumn mentioned, we have a whole juvenile services network for community-based organizations that we're working with the Public Works Alliance and Nickel we have funded at a very modest grant. I think it's up to 60 CBOs to serve our kids in the youth justice space when they get out of custody. And then we have the Rising Scholars Program. That's community college. The governor has given, I think, the first in the nation to say that we are prioritizing community college for youth that are incarcerated. And up to 45 carceral settings are now funded for community college access for kids getting their associate's degree, and in some cases, their bachelor's degree in partnership with our state universities. So I could talk a long time about this. We are definitely putting our money where our mouth is when we want to incentivize these real solutions for adolescents.
Appreciate that. We have quickly arrived at the end of our allotted time. Thank you for the richness and wisdom you brought and perspectives. Want to just create a couple minutes here for any final reflections from any of you, anything that has felt like it's gone unsaid at this point that you'd like to highlight as we wind up.
Maybe I'll just add to the last question about incentivizations. I think part of it goes to what Director Lucero was saying about the importance of narrative shifting. So success for the Children and Youth Behavioral Health Initiative is, yes, decreasing rates of death by suicide, decreasing suicidality, right? More access to healthcare services. But it's also more attendance at school, less disciplinary actions at school, right? So the more that we can have this collective vision of what success looks like, that is promulgated by the very initiatives and efforts that we're doing in a joint fashion, I think we set that model for state, local, community to all embody that and to shift the systems, as has been mentioned, that really center the youth at the core.
Love that. Brenda, can we extend an invitation a year in advance to come back next year and talk about the early integrated plan reporting stuff under BHSA? Because I think you're really setting a standard there, that there's a whole child assessment process at the back end that has to take place. Beautiful. Anything else? All right. Deep appreciation for our panel then. Thank you.